It may not look like much, but the difference between this and this is one of the biggest questions facing Boris Johnson's government right now.
I'm all too aware that the 2-metre rule has big implications for schools and for many other sectors.
The 2-metre social distancing rule has been an integral part of the UK government's coronavirus response. But is it a hard rule that we repeal at our peril, or an overly cautious, arbitrary distance that's holding back the UK's economic recovery? Social distancing measures to fight the spread of illnesses dates back to research carried out in the 1930s by Harvard scientist William Wells. While studying tuberculosis, he discovered that droplets of spit and mucus expelled when we breathe, cough or sneeze usually land within 3 feet of the coughing, breathing or sneezing subject. The World Health Organization's guidelines can be traced back to this research. Their recommendations are that people should keep at least 1 metre away from each other. But it's not all about distance.
There are 2 factors that influence your likelihood of picking up the virus from somebody who's infected. One is the amount of time that you spend in their proximity, and so the longer you spend with them, the more you increase your chances of getting the virus. And the other thing is how close you are. And the further you are away, that you decrease your chance of picking up the virus. And we think that works probably out to about 3 metres, particularly indoors. And we certainly think that the risk of catching the virus at 2 metres is your chances of catching the virus are reduced by about 50% compared to 1 metre. But it's actually really difficult to prove that. It's a lot of estimates.
Various studies have raised questions about the validity of the guidelines, with some saying that the 1 metre rule underestimates how far respiratory drops can travel. MIT professor Lydia Boweber recorded droplets travelling up to 8 metres when she used high-speed cameras to capture coughs and sneezes, while a study in Wuhan, China, that looked for traces of the virus in a hospital ward detected it in the air 4 metres from patients. Social distancing guidelines vary around the world. On the more cautious end of the scale at 2 metres is the UK, Canada and Spain, although Spain plans from June 21st to bring its guidelines in line with these countries over here at 1.5 metres. They'll be joining Germany, Italy, Greece, Portugal, the Netherlands and Australia. France, China, Denmark and Singapore all follow the World Health Organization's 1 metre minimum social distancing measures, and the difference between moving from there to here for many in the hospitality industry could mean the difference between bouncing back or going bust. There's growing pressure from industry leaders and some scientists to update the guidelines to bring us closer to countries around the world who are reopening their economies.
My committee had a joint meeting with our French counterparts a few days ago. They operate a 1 metre rule in France. Their experience has been that this has not been problematical, that there is no substantial debate, we were told, as to whether that should be increased. And so if countries like Germany and Australia, Singapore and Hong Kong, if they have been able successfully to operate that, then I don't think we should just allow this to be the unquestioned default.
Boris Johnson's roadmap to reopen parts of the hospitality industry is penciled in for July the 4th, but if the current social distancing rules stay in place, many establishments say the limits on capacity needed to maintain it will make reopening impossible. However, the fact remains that until a vaccine is discovered, reinfections will remain a risk.
What we're seeing in various parts of the world is the re-emergence of the virus, and we think particularly in Beijing at the moment. In China, we're starting to see a spike in the number of cases, and that is inevitable, I'm afraid, when you start to reduce social distancing, because we know the virus is still out in the community. And so what the government has to do is come up with what is a measured risk. The risk of the fact that the virus will increase in its spread, but how much relaxation are they going to allow without those spikes in cases causing problems to the health service? And that's a really fine balance. And even though the amount of virus out in the community is really low, there's still a chance of onward transmission. And that's why the track and trace is so important, because you need to identify cases as quickly as possible, and then also identify contacts of those people so you can extinguish these potential chains of transmission very quickly. That's something we didn't do before lockdown, and therefore it's important that we are able to do it now.